Hi everyone, hi, it's just Jason here. Just here to answer some questions that we've received from the patient group. I'll try and get through them and explain them as clearly as I can for you. First one, I've got a question here from Chris. Do you recommend that we continue to use Blue M toothpaste and mouthwash? Yes, absolutely. So we recommend this because it's the best stuff for longevity and maintenance of your LTPs. We found that it really helps and keeps them in good nick. So yes, definitely would encourage you to use them. Soft diet, how are you able to chew and to what level? So we recommend generally with a soft diet that anything that can be squished easily with a fork. Probably when we suggest you go on a soft diet, it's probably when you've just had your surgical reset. We want the implants to take nicely. We don't want undue pressure on them. So it's really important that you follow the instructions and stay on anything that you can squish easily with a fork for better outcomes. What happens if there's an alignment issue after fitting the LTPs? Are they adjustable? Absolutely. So the LTPs consist of several components. You've got your titanium bar, which is the rock solid, strong bit of the LTP, and then you've got the medical grade PMMA on top. Now that is our fail-safe, so to speak. It's the part of the LTP which can wear, but it is easily adjustable and easily replaceable as well. So yeah, absolutely, we can tweak those if they're needed to be. If there's a catastrophic event and you damage one of the prosthetics, it depends what you mean by catastrophic event. It's very, very unlikely that you will ever do anything to the titanium bar. I doubt severely that I've not heard anyone who's broken a titanium bar. I'd be very impressed if you do. That's what I was saying before about the medical grade PMMA on top. That is the fail-safe. If anything is going to chip, break, wear, it's the PMMA, and that is the thing that we want to wear, and it's very easily replaced, so don't worry about that. Do we do IV sedation? So we used to, guys, but actually we found in our cohort studies that patient cooperation was actually a lot better without IV sedation. Patients coped a lot better. It was easier for me to do your procedure for you. It was just a lot more predictable. I know it's hard, I know it's scary, but from my opinion, it's not necessary. You can do it, Jenny. It is scary, I know, but you're in good hands and you'll be absolutely fine, okay? Do you contact us for yearly reviews? Absolutely, so we stipulate that we do want to see you every year for your annual maintenance. It's important that we look after you. We keep an eye on things, diagnose anything that needs to be looked at early, but we're really confident in our solution and how we do things that yearly annual reviews are absolutely fine. Usually from the date that you have your LTP fitted. One of our really helpful patient liaison officers will be in touch. They'll be right on it. I'm sure as you guys all know, you have your WhatsApp groups. Don't worry, you're never left to kind of slip through the net. I am 3 weeks post-surgery and my mouth feels full of plastic, making it difficult. Okay, Romy, I hope it's that. So you're in your deprogrammers, I assume. Generally, so the deprogrammers have to be a certain thickness because they're just pure PMMA. So generally, in my experience, a lot of patients do comment that it feels a bit bulky in there and such. The LTPs, because you've got that titanium bar, which is a lot stronger in thinner sections, I've often had comments that people tell me that it does feel a little bit thinner, it's a bit nicer, a bit more comfortable. But everyone's mouth heals differently. You will adapt. It's all about adaptation, adaptation, adaptation. Don't worry, you will get there, don't worry. Mr. Lumpy, infamous Mr. Lumpy. How long could a swelling last before disappearing? Okay, so Mr. Lumpy is, unfortunately, in essence, a blood clot. It's like a bruise underneath the roof of your mouth. At the moment, it's something that everyone probably gets to a certain extent and varying degrees. Like a bruise that you get, on your arm, your leg, wherever, it goes eventually. It just takes time. A lot of it's down to your own body healing as well. So, be patient. I know it's a nuisance. It'll get there. Don't worry about it. The worst thing you can do is play with it, mess with it, because you're just going to aggravate him. And it's just going to get worse and aggravate you more. So he'll go in time. The mouth generally heals very quickly. So I wouldn't worry about how it takes. The mouth will do what it needs to do. So just follow all the instructions that we give you, keep on top of it, and you'll be absolutely fine. One of the best things about our company, 21D, is that we are always looking to improve things and get better. And between me and you guys, we are working on something. It's definitely in the pipeline, and we are hoping to get rid of Mr. Lumpy very soon. Intending to drive down from Aberdeenshire, Jim? Okay. I'm a piper. Interesting. Piper as in smoker, I assume. or a Pied Piper, I don't know. So, okay, the surgical reset is quite a big thing. Generally for me, I always recommend that you bring somebody with you. I think it's just nice to have a bit of emotional support, a bit of comfort. Depending how you feel, you're coming from quite a long way, Dean. I would say it's nice to sometimes have a nice rest, after the surgical reset. Some people I know, they just want to get back to their own beds and they love it. I'm a creature of comfort. I would love to be in my own bed as well, rather than in a hotel. But it's a big thing you're having done. For me, generally, I would suggest someone comes with you. Maybe they can drive you back if you really want to get back home. It just means that you can rest a bit, because it can be a little bit tiring after you've had your surgical reset. So just think about, the impacts afterwards. Does anyone lose a lot of blood during the surgery to lower blood pressure? So everyone's different, Francine. Oozing bleeding is absolutely normal. I'd be concerned if you didn't bleed, really. It's good, it helps to heal things as well. Generally, I don't think a lot of people have lowered blood pressure and had a big issue with it. If anything, it goes the other way, because they're just that excited to be here. No, I mean, nerves are going to play a part, so your blood pressure is going to be up. It's generally not a problem. You're going to be absolutely fine. Take all your medications if you have any, follow the instructions that we give you pre and post-op, and you'll be absolutely fine. Are there any supplements to help maintain our bone and gums? I always think that vitamin D tablets are not a great thing. I know in the Northwest here we don't get a lot of sunshine. It's all about bone and healing. So vitamin D to keep on top of things and promote healing. Cleaning routines, yeah, absolutely. You nailed it, Tracy. Don't brush the gums. Once they're healing, you don't want to brush them because it's going to cause them to shrink a lot more. And you don't want to be pulling your lip around as well, because you need everything to be static and allow it to heal. Let the body do what it needs to do. Rest is the best thing you can do. What would happen if implants failed? Okay, so generally our solution has multiple implants. It is very unlikely. I've never seen a case, to my knowledge, that everything's failed. At the end of the day, the only thing we can't control here, guys, is your biology, how your healing is. But don't worry, we always have a fail-safe in plan. We're always looking at the future. It's not just a one-off event that we're looking at with you. So don't worry, we've always got you. We're not going to leave you in the lurch. You'll be taken care of if anything does happen, because things happen. We can't always control everything. We try and manage every situation, eventuality, but don't worry, we'll look after you. And Lisa asks, no questions, silly Lisa. If 3 of the 4 implants pertain at the front, does the black prosthetic remain stable with no movement? Our solution predominantly places implants in the front regions of your mouth. It's normally where there's most available bone and good bone quality and density. We have engineered things on the LTP so that we account for the forces of chewing. So yeah, we definitely account for all of that, and the prosthetic is in place and it sats really nicely to the implants. It's all controlled and calculated in a certain way to best give you the most predictable long-term outcomes. Is it good practice to keep So good practice to keep a dentist locally, or do we stick with 21D? So once you've had the treatment with us, I would highly recommend that you come to see us. Any issues, come to see us. We obviously know your case inside out, and we know what to do. I think with some dentists, they may not have the sufficient training or knowledge. You're better off just coming to us, and we're more than happy to answer and help any queries that you have. And Anne asks, I'm 3 weeks after surgery and the gums and top feel loose at the ends. Yes, absolutely. Gums, everything's going to be healing, Anne. 3 weeks, if you think of it in the grand scale of things, is not a long time yet. Everything's still healing. It takes a little bit of time. Just follow all the instructions like we said. Keep on it and you'll be absolutely fine. But as you all know, we have our WhatsApp groups. Give us a shout if you need anything and we'll be happy to answer it. Okay. Yeah, so that's all the questions there. Yeah, thanks for sending your questions, guys. I hope it's been helpful. I hope it's helped to, answer some of your questions and ease any anxieties about anything. Like I said, don't worry, you guys are going to be absolutely fine. You're the bravest people I know, and we hope to see you soon. All right, take care.